Good evening, everybody. Let me introduce myself. I'm Alberto Beretta. I'm an MD, PhD. I'm an immunologist. Done most of my career in science and a little bit of medicine. Years ago, I founded SoLongevity, and 3 years ago, we decided to move to a non-profit organization, SoLongevity Foundation. The first move of the SoLongevity Foundation was to co-organize with Brain Circle Italy the Milan Longevity Summit, which is this year will have its third edition. I'm sure you have seen it already. You are aware of it. It's a major event. We've been able to bring to Milano the brightest mind in longevity science. Last year we had two Nobel laureates, Venki Ramakrishna and Shinya Yamanaka. This year we'll have Thomas Sudoff, who was laureated in 2013 for the discovery of brain synapses mechanisms. We have in the 2026 edition, we have the best speakers from all over the world talking about biology of aging, physiology of aging, biomarkers, etc. Now, that experience took us to a major consideration. We just realized that the science of longevity is growing faster, much faster than what we think. And there is a gap in the translation of this science to clinical practice. It's not an easy gap to fill because science is always very sophisticated, requires specific skills and understandings. And so we came to this idea of organizing the first course on longevity medicine for longevity MD specialists. Because medicine today is undergoing, as you know, a structural transition. Historically, it has been predominantly reactive, focused on diagnosis and treating diseases. However, current scientific and technological advances increasingly support a more anticipatory, systems-oriented approach. Longevity medicine is an expression of this general switch of medicine. It is grounded on the idea that aging is complex, measurable, and partially modifiable process. The objective is not simply to extend lifespan, as you know, but mainly is to extend health span. This transition has some implication for clinical practice. It calls for physicians capable of integrating molecular biology, advanced diagnostics, personalized interventions within a coherent framework. It's not easy. To address this, we have developed this advanced course in longevity medicine, and the program is designed to translate advances in longevity science into structured, clinical applicable tools. Now, ultimately, the question is not whether medicine will evolve in this direction, but how, and who will be prepared to lead that evolution. Thank you, and now we go into the specific program. The course essentially is, yes, thank you, Guido. Will train doctors to become an MD, a longevity MD specialist, working on early diagnostics, prevention of chronic diseases, understanding of biological aging clocks, physiological reserve, methods of measurement, therapeutic innovation, and essentially clinical practice. It's an advanced training program for medical professionals who want to integrate biology and clinical practice in the service of healthy longevity. Next slide, please. So we go essentially from disease medicine to preventative and enhancing medicine. The objective is maximizing health span, and the new clinical competencies that are required for that are transitioning from reactive to proactive patient management, and the tools, advanced amnestic techniques, and new patients engagement strategies. Next slide, please, Guido. And then
it's Ellas.
Oh, yes, right. So now I'll leave the word to Ellas, who is the co-organizer with us of this course, and then I'll take it back later. Thank you, Ellas.
Thank you. Thank you, Alberto. Thank you very much. So first of all, thank you all for being here. We are so happy that so many of you have been able to join, and from all over the world. So really happy. Well, first, let me introduce myself. So I'm Hella Sina, and I work as an academic at University of Pavia, but I'm also a clinical nutritionist. So I'm a medical doctor working in a medical hospital. And I was really happy when Alberto Guido and SoLongevity asked me, about my contribute to this course, because from my perspective, this shift from disease medicine to preventive and enhancement made medicine is not just timely, it is necessary. So if you are here wondering why this initiative makes sense, I will answer to you saying that today healthcare systems are still largely organized around disease. So we diagnose, we treat, we often treat too late. And however, though epidemiological reality has changed a lot, chronic diseases like obesity, metabolic disorders, cardiovascular conditions, oncological conditions are driven by long-term interactions between lifestyle, environment, biology, and we care about lifespan, but not enough about health span, as Alberto said. So from an academic and clinical standpoint, this creates a clear gap. We have increasing scientific knowledge on prevention, but limited translation into practice. So an initiative like this course is therefore very important because it helps bridge the three key gaps: the gap between evidence and implementation, the gap between reactive and proactive care, the gap between single discipline and multidisciplinary approaches, well integrated one to the other one. And in other words, it aligns clinical practice with what science already tells us, that health is dynamic and modifiable. So if your second question is why training in precision is needed, well, I would say that the training in precision is needed because we have to tailor our knowledge and our clinical practice to specific target. So we are trying with this course to tailor to longevity, and we cannot really afford to be generic anymore. We know that individuals respond differently to the same diet, to the same intervention, to the same lifestyle exposures, because this variability, inter-individual variability, is driven by multiple factors: biological, environmental, behavioral, and social. So this is why we are moving towards a more integrated model where we consider the totality of exposures along lifespans. And in this context, clinicians need new competencies. This is a purpose, the ability to interpret complex and multidimensional data, to move from standard recommendations to personalized strategies, to actively engage patients in long-term changes. And this is not traditionally part of the medical training, or is it? And this is what exactly why structured education is needed. The so long called long life, learning. So the real question is whether we equip clinicians with the right tools to lead it, or whether we remain anchored to a model that is no longer sufficient. Initiatives like this are essential. I think that they are essential to make prevention, to make treatment, not just a concept, but a clinical reality. So I'll give you back the word.
Thank you, Alice. Very nice, very clear. Guido, can you go to that? So the course is essentially is an asynchronous technical course made of more than 80 hours of teaching with 11 different training modules, plus an optional 80 hours on internship and 30 specialized lectures. It's divided in two programs. I'm sure you know already the diagnostic program, which is made of 48 hours, and the therapeutic program made of 29 hours, which will start in October. The 11 modules are essentially focused on an introduction on longevity medicine, and then the module 2 it will be about the biological foundation of aging. Module 3, human physiology of aging. Then we will talk about biological markers of aging, physiological markers of aging, imaging technologies, longevity intervention strategies, clinical applications, ethical and social aspects, professional paradigm switch, very important, and then finally, optional clinical internship. Let's talk about the fourth module. We have a very, very interesting lesson from Diego Bastos. We will review the whole science hallmarks of aging one by one. As you know, now there are 12, so it's a very interesting field of investigation. Then we will have a course on a lecture on the genetics of longevity by Paolo Garagnani, who's a distinguished scientist in Bologna, who works a lot to publish a lot of interesting papers on genetics of longevity, of centenarians specifically. We will have Fabio Sallustio illustrating us the longevity pathways, the most important longevity pathways, mTOR, IGF-1, SIR2, and Clotho. And then we will have Claudio Franceschi. As you know, he's the father of immunoinflammaging, and he will talk about inflammaging, immunosenescence, and immune resilience. Next slide. Then we will have a panel of lectures on genetics and epigenetics of aging. Davide Cacchiarelli works in Telethon Foundation in Italy, in Rome, and he's an expert on genetic profilation and epigenetic profilation of people. We will have Austin Argentieri from Broad Institute in Boston talking about metabolomics and proteomics. He published a very nice paper last year on Nature Aging about a big study on the British cohort. We will talk about microbiome. We will talk about liquid biopsy, advanced blood chemistry, and mitochondrial function and immunosenescence. This is also, of course, a very important session. All of them very interesting lecture. Next slide, Guido.
Now is Alberto.
Oh, yeah. So I'll give the word to Alberto. We already ate. Good. Alberto.
Thanks a lot. Yeah. I'm not sleeping. Thank you for all of us to be here. I'm really happy to share our experience because I'm a medical doctor. I'm a sports medicine physician. I work in internal medicine department for almost 5 years. And I started my journey with SoLongevity almost 3 years ago. This course starts also from our medical perspective, especially for our clinical practice in the last 2 years, because we saw at least more than 1,000 patients in our clinic right now. And I think that there is a gap between the standard academic formation and the longevity field, because we need to be more focused about prevention, precision medicine, and the approach to the longevity field, especially because people are aging. In Italy is one of the most important country in the world about this, and we also focus better on the prevention and all the things that we can do with the technology and the new science that join us every day. So this model and this slide represent very well what we will discuss in the course. We will talk about the physiological system, especially in the aging process, and how they are connected together, because we will talk about cardiovascular disease, neurological condition, respiratory condition, especially not only COPD, asthma, and disease related to aging, but also how to improve the lung capacity and the breathing techniques. So we will see a lot of things how we can improve our quality of life, of course. We will also address some of the major disease and alteration that starts in the aging process. Musculoskeletal condition like sarcopenia, osteopenia, and the strength change in strength and bone density are really important to address. And I will be a speaker about the body composition in the diagnostic module, and we'll see how it is important to address this kind of change in aging, especially from a metabolic perspective, and also because we will talk about all the changes in the hormone changes that can occur in the both men and women. I think that one of the most important things in longevity field is also to address differently the aging process in men and women. This because the gender medicine is very important in the longevity field, and we will talk about this in a very different way with different speakers from all over the world, especially for a clinical perspective. That it is how Professoressa Cena talked earlier. It's very important because clinical practice is a non-negotiable thing that all the clinicians should have, especially if they work in the longevity field. Okay. We will also discuss about the functional testing and advanced imaging. I think that for me, especially as a sports medicine physician, it's a natural course of my specialization. But I think that a longevity doctor should know very well some functional tests that are really important. We will talk about biomarkers, but functional biomarkers like VO2 max, strength muscle testing, DEX and body composition, are the most important biomarkers that we have, especially for building a trajectory of the health span. We will also talk about the cardiopulmonary exercise testing with two experts in the sports medicine field. This is a test that is underrated and most underevaluated in the medical clinical practice, but this test could improve our skill to intercept a condition, not only a disease, especially because it can merge together how muscle, lung, and heart can work together. And I think that a longevity physician should know very well how the body works, especially under stress condition. And this is very important. We will also address the cognitive function. We will try to decoding all the process that it's behind the cognitive decline, mild cognitive impairment, the cognitive function, especially in stimulation and improve in a patient and a person that is in a health status, but it's going to aging. And this is very important because we will also talk about some functional neuroimaging tests that are improving a lot our capability to address a prior condition prior to a disease. And this is, I think that's one of the best part of the longevity area is the assessment of neurological condition. We will also talk about the advanced imaging, especially in cardiovascular disease, because the main cause of death and hospitalization in our country is the cardiovascular and cardiometabolic disorder. So I think that knowing which test to address to every single patient is the most important part, because we right now have many technology that can help us. CT scan, coronary artery calcium score is one of the most important things, the ultrasound, and also all the wearables part that should be in the package of the clinical longevity doctor, because many patients join us and come to us with a lot of medical device, and not only medical, but also fitness device trackers that merge a lot of data, continuous glucose monitoring, HRV, sleep quality, saturation, and other biomarkers that we right now can measure. So Guido, you can go on. We will also talk about of course, the intervention strategies that we can use. We will talk a lot about more than 8 hours about precision nutrition. Times are changing. We have right now many technology and many biological tests that we can do based on genetics and omics science, like metabolomics, microbiome testing, and many other tests that longevity doctors should know very well, especially when we merge and put all this data together in a single person. We will talk about the nutraceuticals and targeted supplementation. We will talk about nutrition plans, caloric restriction, and many type of medical dieting approach, because every longevity doctor should know also which diet is better for every single patient, with a focus on metabolism, cardiovascular, and neurocognitive, of course. We will talk about the physical activity, not only about sports, but also in training models, exercise prescription, and longevity protocols for health span, improving health span, of course. We'll talk about the respiratory rehabilitation. Not many people talk about this, but it's very important to improve the lung capacity, because we need oxygen and we need to breathe in our life. So we cannot eat for very many days, but we need to breathe every single moment. So I think it's one of the most important parts. And of course, we will address two of the pillars with physical activity and nutrition. There are sleep and stress management. This is very important because many clients, many patients that join us are having sleep troubles and stress, overwhelming stress and sleep disorders that right now should be addressed and treated and optimized. Because sleep, for example, is one of the most important things that can worsen the physiological condition of every single patient. We will, of course, talk about the new molecules and new technology that will join us. Right now, the most famous are the GLP-1 agonists, dual agonists. We will see how many drugs are coming. Probably in the next 5 years, at least 30 new compounds will join the clinical practice, especially in cardiometabolic treatment and prevention. We will talk about some drugs in cardiovascular disease approach that are becoming very interesting, especially monoclonal antibodies and many other compounds that can improve the targeted therapy, especially in patients with many risk factors. We will also talk about pharmacological approach to neurocognitive disorders, and especially for the hormone replacement therapy. Italy is one of the worst actually in this field because there are many regulation, many logistic approach to this, but I think that especially for women after menopause, it's one of the most important things to address the right therapy, especially the hormone therapy for the health span and quality of life, of course. We'll talk about many different compounds. Right now, senolytics and geroprotectors are one of the most important. Many drugs are coming out, many bioactive peptides, of course. And in the next year, I think that many things can change, and we try to explain this with many speakers that join us from academy and of course from clinical practice. And this is, I think, that's one of the part that could be very interesting, especially because it's every day new molecule started to being studied and put in clinical practice. We will also talk about regenerative medicine. A longevity physician should know which weapons can use and for improving the regeneration therapy, like stem cells, mesenchymal stem cell, PRP, and many other compounds that will come in the next years. We will also talk about biohacking. I don't like very much this word, but it's one of the most used in the last 2 years, of course, with the longevity word, of course. And we will talk about the effects that some biohacking tools can improve the quality of life and the performance of the person. We will talk about photobiomodulation, ozone therapy, cold therapy, and cryotherapy, of course, hypoxia, hyperoxia treatment, hyperbaric chambers, and so on. We will address also the IV therapy. It's very important because right now many people started to do this without medical advice. So I think that this part is very useful, especially for putting a clinical practice background before starting an infusion therapy that is could be very dangerous in some situation. We are near the last 2 slides for me. Of course, a medical doctor and longevity physician should know how to use artificial intelligence AI in clinical practice, not only for collect data, analyze data, but also for decisional support. It's very important because right now we have hundreds of biomarkers, hundreds of different diagnoses that we can address in a single patient. So it's very important to use it, not for changing our way to practice without a medical doctor, but to improve our capability to recognize a disease, personalization therapy, screening of chronic condition, and now outcome prediction. And this is very important in clinical practice because many fields of the longevity medicine are changing a lot with AI. Radiology, cardiovascular disease, metabolic disorder, of course, also oncological conditions. So I think that we put also a few topics and few talks about how to improve also some bioethics problem that could be faced in our practice, the public health, and of course the regulation of new therapeutics, drugs, and new technology that every day, especially in social media, are joining our daily practice. This is very important because I think that, and I'm concluding it, we need to change the paradigm of the medical doctor that works only when a disease is in course, and also we have to change the way that we can do, for example, an anamnesis interview, and find a way to improve our engagement strategy with the patient. This is the last part, but I think it's very important because we need to improve the lifestyle intervention in every single patient, and we need to be more focused about the changing of the lifestyle patient that can do. So I think that Guido, this is my last slide, and I give you the talk.
Lucia, you want to start?
Yes, here I am. Let me introduce myself. I'm Lucia Marazzi, Head of Technology Transfer of University of Pavia, and under my responsibilities include also our lifelong learning office. Thus, I'm here to, after so much science, to enter into some technicalities. So, and explain how the two modules which compose the whole course will be attended. So you see, we have two main modules. Each one of them will be could be attended separately or together. 88 contact hours with another 80 hours of optional internship. The diagnostic program will be online starting June this year. And while the second module, the therapeutic program, will be online starting October this year. We can move to the other slide. Everything will be very, very simple. We have our own platform, which is whose address is ecm.unipv.it. And you just register yourself here where you see University of Pavia. You will find your name when you log in, and to register, you need to provide some basic details such as place and date of birth, and fiscal code if you are Italian. Otherwise, you will have the possibility to check that you were born abroad and stay, and you are from abroad, and whatever, and then your profession and the discipline and your discipline, and then we move to the other slide. You will see that this is the image of the first module. You will be able to click and enter when you have registered the first module, and you will find yourself in a sequence of lessons followed by training moments, in which you will be able to understand if the lesson have been correctly acquired, and if you need maybe some more analysis, whatever. And so lesson after lessons, you will be able to follow the whole module. I think it's very important to underline that not only the two modules offers a very comprehensive analysis of longevity medicine, but they also offer ECM credit in the national agency, but also we are working into providing European credits. So there will be 30 credits per module for the Italian national program, and we are still working on defining the European credits. I think these almost cover everything technicality, but of course, if you have any questions, not every. Here I see there are the fees, the registration option. You can, as I mentioned, you are going to explain that? Okay, perfect.
We'll talk about it. Thank you,
okay,
Lucia.
thank you, Guido.
Okay, thank you to everyone. I'm Guido Cornettone, CEO and co-founder of SoLongevity. Today, I just would like to highlight that at the end of the core, we provide for the ones that has been through all the 2 modules, we provide an European badge, so certifications of your, let's say, capabilities and credits. The 2 modules has been designed to be independent. You can attend one and eventually the second one, or you can go through both. Of course, before going to the longevity therapies, you must go through the longevity diagnostics. And there is a specific promotions that we run for the ones that subscribe the webinar, and the fourth for the coming week is that a special prize to, let's say, to prize and prime the early adopter. And so please, if you have any thought, profit of this opportunity. And the process that will be applied is this one. These programs will be entitled only for certified physicians, MD doctors. And so we are going to check, once you have run the web applications, we are going to run a validation check. So certified, that's huge, are, let's say, you have all the certified conditions. Then we are going to send you a payment link for the down payment and the moments just before the kickoff of each module. We finalize the payments and we send you the credentials for accessing, entering the educational platforms. That's the process. The kickoff or the first module will be the last week of June. The ones that will subscribe the modules will receive with a couple of weeks before the confirmations of all the details and let's say the availability of all the modules within the course, and that's it. And that's the information that we should provide. Of course, if any of you have any questions for the lesson for the professor or about the registration fee and the process, please feel free. Just a reminder that like this webinar, all the courses will be in English, all the materials will be in English, and after each lesson will be provided a fake examination test that allows you to train yourself in entering to the final certification examinations for, let's say, be eligible for the credits, the educational credits that Lucia has just mentioned. So if you have any questions, please feel free. We have still 20 minutes if needed, and feel free.
Guido, I see that there's a question.
Please, let me check. Let me check.
Is the course online?
Yes.
Yes, it is. It's asynchronous. You can enter starting June, the end of June, and it will be online for a whole year.
Yes, let me say that has been designed for professionals that are currently working. So that's the reason why we have chosen the asynchronous mode. So it means that you can plan, decide, and run the lessons whenever and whatever you have times for running it. So it could be the weekend, could be launch pause when you can and you want. And you can also revise the lessons if you need. So it's totally feasible for professionals that are currently busy with their own schedule. Okay, I think that's in any case. If you have you have any additional doubts, any additional information that you need, please write back to the address that will be present in this slide. We will share the presentations for whoever have subscribed the webinar. So you can revise it, you can check it, and eventually you can write to us. We will be happy to answer, and we hope to see most of you during the programs and profiting of this opportunity. Thank you so much. Have a nice night
Guido,
and day.
sorry, Guido. There's another last question. What about the final examination? It's
So
the question.
please, Lucia, answer you. You are.
Yeah, according to the regulation, it will be a test with random questions and four possible answers. Only one of them will be correct, and the pass will be after giving the 75% of answers correct answers. And the test can be taken up to 5 times after reviewing the relevant lessons. As Guido has mentioned, training sessions are present all along the module, so that the student can be sure to arrive very well prepared to the final test.
Okay, there is another question about the internships, and the internships will last 2 weeks from Monday to Friday. Will be run within Longevity Clinic in Milan. That's the reason why we offer as an option. So we would like that everyone's we go through these 2 weeks of longevity practice, medical longevity practice, but we know that not everyone, there is a number of attendants that are abroad, maybe they have not chance. That's the reason why we provided it as an optional. So the physicians that has been through the 2 models then will be invited for a couple of weeks to work with us and experience by live with the coaching of Alberto and the other physicians that we have there, experience how works longevity clinics applying the kind of medicine that we have showed during this webinar. So I think that there is no other questions. So thank you so much for your time, for your patience. I've seen that 60 participants has followed through all the webinars. So thank you again, and hope to see you soon. Bye. Have a nice day. Bye.
Bye-bye.
Bye.
Bye.